here. So first of all, it is approved for, we do use it, and it's approved for all skin types. So we use this not just on Asians, but even on Africans and Fitzpatrick type 6. So we do recommend some adjustments and the protocol. We do adjust the energy level slightly, but it is approved for all skin types, and we do use it in our practice on all skin types. So it's not true that it's not friendly for Asian skin. And actually, some of our best results, and the one that you saw there with the clockwise, that is Arash's wife. And so, I don't exactly know her heritage, Jeffrey. I don't know, but I would say she's like a Fitzpatrick 4.
Yeah.
She's not Caucasian. And she had beautiful results with it. And so definitely a lot of different types of Asian skin can be treated with this device. Now, where this gets the reputation of not being friendly for Asian or Fitzpatrick 4 through 6, let's just take the culture out of it and just say Fitz 4 through 6, is when we're using other devices that are not really plasma devices. So they're usually some sort of device that's using radio frequency or electrocautery, and it looks very similar. And so if I were not educated on the technology and I was just to look at Instagram or TikTok, and I see a lot of these handheld devices and people are creating these sparks, and I don't understand what's being generated there, it may not look different between plasma and electricity and radio frequency. And so if I don't understand how that energy is being generated and delivered, then I may miss the fact that I'm creating a lot of thermal damage. So when we think back on that slide about sublimation and how we can remove tissue altogether with that without creating a lot of thermal damage around where we're delivering the energy, then it would be easy for me to mistake different devices that look similar, but the results are drastically different. Some of these devices you can buy for, a few hundred to a few $1,000s, but they're incredibly dangerous. And that's the ones that I saw, and I don't want to call it any particular profession, but literally that's the one I saw non-medical people buying these devices off of Amazon. And literally some of the patients, the management that we had to do to treat the scarring from it, it was a nightmare. And it took, one patient maybe 9 months before we ever had resolution.
Mm.
But once I realized that it's a totally different device, obviously this is a medical grade device. This is a medical treatment. This is something that we're not going to just create burn superficially in the skin. We're delivering plasma energy deep down to the fibroblast that is creating collagen and elastin. So it is a different price point. And so, that should be your first clue when you're getting something that doesn't require a medical license off of Amazon for a few $100s. It's not the same thing. And that will create some problems. And we definitely have seen problems with darker skin types. So in my practice, to answer, we have not. And so I've treated, people of Mexican heritage, Filipinos, Brazilians, Portuguese. So a variety of darker skin types, and have had no problems. Actually, the patient that I had, the most prolonged healing was a very aggressive treatment that I did, but she was Caucasian, Fitzpatrick 2. And we just was very aggressive with the barcode, the lip line treatment around her mouth. And it took her a little bit longer to heal than most, but the actual kind of dark spots went away quickly, and she was red. And that lasted maybe around 4 to 5 weeks. So again, not months. We were somewhere around a month before it resolved, but she had a phenomenal result from the treatment, but was a little bit red longer than I would normally anticipate.